Cold hands, numb feet, that burning or tingling feeling that never fully goes away. Most people are told this is just a normal part of getting older, but it isn't. These are not small annoyances. They are clear signals that the delivery system inside your body, the one that brings oxygen and nutrients to every single cell, is no longer working the way it should. And when circulation starts to weaken, the effects go far beyond cold fingers. Memory becomes less sharp, pain becomes more constant, and independence slowly starts to slip away. But here's the part that most seniors never hear. Poor circulation is not something you have to live with after 60. In fact, there are two essential nutrients that research shows can help support healthy blood flow from the inside out, even later in life. By the end of this video, you'll know exactly what they are, how they work together, and the one common mistake that prevents many people from getting results. This is for educational purposes only. It's not medical advice. And if you manage health conditions or take medications, it's always wise to speak with your healthcare provider before making changes. Now let's talk about what's really happening. The root of most circulation problems in older adults starts inside the blood vessels themselves. Imagine the blood vessels in your body like water pipes in an old house. When you were younger, those pipes were smooth, flexible, and wide open. Blood flowed easily to your hands, feet, and brain. Over the years, something changes. Low-grade inflammation, everyday toxins, and common dietary habits begin to damage the delicate inner lining of those vessels. That inner lining is called the endothelium, and when it becomes stiff and irritated, blood vessels lose their ability to open and relax properly. This doesn't start with a major blockage. It starts small. The tiniest vessels, the ones feeding your toes, fingertips, and nerves, begin to struggle first. That's when numbness appears. Coldness becomes constant. Weakness creeps in. The encouraging news is this kind of damage can improve when you give the body the right tools, and most seniors are missing one of the most important ones. The first key nutrient for supporting healthy blood flow is vitamin K2, specifically the MK7 form. Many people only associate vitamin K with clotting, but K2 plays a completely different role. Think of it as a traffic controller for calcium in your body. Calcium is essential for bones, but when blood vessels are damaged, calcium can begin settling in places it doesn't belong, like the walls of your arteries. Over time, that makes vessels stiff instead of flexible. Vitamin K2 activates proteins that help move calcium out of the arteries and into bones where it belongs. When vessels regain flexibility, blood can move more freely again, especially to the hands and feet. This isn't about masking symptoms. It's about supporting the structure of the vessels themselves. And a lack of K2 is far more common than most people realize. But here's where things get even more interesting. K2 works best when paired with a second nutrient, one that helps blood vessels relax and widen naturally, and that's where vitamin D3 comes in. Vitamin D3 is often talked about for bones, but its role in circulation is just as important. Vitamin D3 acts more like a hormone than a simple vitamin. Its receptors are found throughout the body, including inside the cells that line your blood vessels. When vitamin D levels are low, those vessel walls lose one of their most important abilities, the ability to relax. Your body relies on a compound called nitric oxide to tell blood vessels when to widen. Nitric oxide lowers resistance, improves flow, and helps oxygen reach tissues more efficiently. Vitamin D3 supports your body's ability to produce nitric oxide. When levels are low, blood vessels stay more constricted than they should. That leads to sluggish circulation, cold extremities, and higher pressure inside the system. Vitamin D3 also plays a major role in calming inflammation. And inflammation is one of the main reasons the inner lining of blood vessels becomes damaged in the first place. This is why vitamin K2 and vitamin D3 work so well together. K2 helps clear calcium from the vessel walls, restoring flexibility. D3 helps those vessels relax and respond properly. One cleans the pipes, the other helps them open. For many seniors, an effective daily range for vitamin D3 falls between 2,000 and 5,000 international units depending on individual needs. Testing levels with a simple blood test is always the safest approach. Now, supplements alone are not enough. For these nutrients to work properly, the body needs the right environment. That environment starts with food. For natural sources of vitamin K2, fermented foods are the most concentrated. Natto contains the highest amount, though not everyone enjoys it. Hard cheeses like Gouda and Swiss, along with grass-fed butter, provide smaller but meaningful amounts. Vitamin D3 is best produced through sunlight, but that becomes difficult for many seniors, especially in colder months. Fatty fish, fortified dairy, and eggs can help, but many people still fall short. This is where another group of foods becomes important: foods that support nitric oxide production. These foods provide the raw materials your body uses to relax blood vessels. Beets are one of the most effective. Spinach and arugula are excellent choices. Even small amounts of dark chocolate can support this process. Together, these foods create the foundation that allows K2 and D3 to do their job more efficiently. There are also a few simple habits that quietly make a huge difference. Hydration is one of the most overlooked. Blood is largely water. Even mild dehydration makes it thicker and slower, placing more strain on the heart and reducing flow to the extremities. A general guideline is to aim for roughly half your body weight in ounces of water spread throughout the day. Movement matters just as much. You don't need intense exercise. Walking for 10 to 15 minutes, 2 or 3 times per day, helps activate the muscles in your legs, which act as a natural pump to move blood back toward the heart. This is especially helpful for reducing swelling and heaviness in the lower legs. Now there's a related issue many seniors experience alongside poor circulation: nerve discomfort, burning, tingling, or stabbing sensations in the feet or hands often come from nerves that are not receiving enough oxygen and nutrients. When those tiny blood vessels fail to deliver what nerves need, the nerves begin sending distress signals. In addition to improving blood flow, there is one nutrient that directly supports nerve health: alpha lipoic acid. This compound works as a powerful antioxidant and is able to enter nerve cells easily. Studies have shown that consistent use can help reduce nerve discomfort and numbness when circulation is also being addressed. But blood flow and nerve repair must happen together. Fixing one without the other limits results. Posture is one of the most underestimated tools for circulation. When you sit for long periods, especially slouched forward, you compress major blood vessels in the hips and lower abdomen. That compression slows the return of blood from your legs and feet. A simple habit can make a real difference. At least once every hour, stand up and move for about 1 minute. Walk, stretch, or gently shift your weight. This small action helps restart healthy blood flow. Elevation is another powerful free technique. When you rest, try raising your feet slightly above heart level for about 15 minutes. Gravity helps pooled blood move back toward your core, reducing swelling and heaviness in the legs and ankles. Breathing also plays a role many people overlook. Slow, deep belly breathing creates gentle pressure changes in your chest that help pull blood back toward the heart. Just a few minutes a day of calm, deep breathing can make your circulation work more efficiently. Now let's talk about the mistakes that quietly block progress. The first is chronic stress. When stress hormones stay elevated, blood vessels tighten. This works directly against everything you're trying to improve. Even short daily moments of relaxation can help. Quiet breathing, gentle stretching, or listening to calming music all support healthier vessel function. The second mistake is avoiding healthy fats. Many seniors replace natural fats with processed vegetable oils. These oils promote inflammation, which damages the inner lining of blood vessels. Fats like olive oil, avocados, and omega fats from fish support flexibility and reduce irritation in the vessel walls. The third mistake is poor sleep. Deep sleep is when your body repairs the lining of blood vessels and balances hormones. Consistently short or disrupted sleep keeps inflammation active and circulation compromised. Aim for regular, restful sleep as part of your circulation routine. Some people also choose to add supportive nutrients beyond the foundation. Certain amino acids help the body produce nitric oxide, the natural compound that helps vessels relax. Others support cellular energy, especially in the heart, which powers circulation. These can be useful additions, but they work best only after the basics are in place. Now let's bring everything together into a simple daily approach. In the morning, focus on your foundation. Support your body with vitamin K2 in the MK7 form and vitamin D3 at levels appropriate for your needs, taken with a small amount of healthy fat. Throughout the day, hydrate consistently. Move briefly each hour, include foods that support nitric oxide production. If nerve discomfort is present, consider nutrients that support nerve health alongside improved blood flow. Later in the day, elevate your legs and practice slow breathing. At night, protect your sleep. This is not about one pill or one trick. Oh, it's about creating an environment where blood vessels can recover their flexibility and function. Here's the most important message. Age is not a sentence. Even after 60, the body has a strong capacity to adapt and respond when given the right support. Cold hands, numb feet, and constant tingling do not have to define your future. Small, consistent changes can support comfort, energy, and independence. If this helped you, consider subscribing to Dr. Emily Carter, Senior Health, for more practical guidance designed for seniors. And leave a comment sharing which step you plan to start with today.